As testing for the coronavirus has ramped up across the state, we've learned none of the testing systems are foolproof. Most recently, officials at the University of Arizona reported a number of false positive cases. It reminds experts of the evolving nature of science. Here's Felicia Goodrum, professor of immunobiology at the University of Arizona.
The consequences of that, in the case of a false negative, someone gets the reassurance that they're not infected. So maybe if they're sick, it's something else other than COVID, but they're actually still contagious potentially, and infected with COVID, and now they don't know that. Um, with a false positive, there is less of a risk overall in that someone may end up isolating themselves for 14 days unnecessarily. But in the context of a university campus, for example, they're setting up dormitories to house COVID infected individuals. And so a false positive could lead to the quarantining of an individual that is truly negative, but with people who are infected with COVID. So they're then at risk for infection.
So it sounds like what you're saying, because I'm not a scientist, and it sounds like the science isn't always perfect, but folks like yourselves are trying to manage all that in these unknowns. And it's not just this virus. I mean, this sort of thing has happened before.
Yes. And so there is always a degree of uncertainty in science. I think scientists are really used to working in that uncertain territory. We're really standing at the precipice of what is known, and we're always searching into the unknown. So we get comfortable with a degree of uncertainty, but it's very complicated for people who are searching for answers and need to know to deal with that uncertainty.
As schools begin to reopen, whether it's college or K through 12, I mean, who's the new vulnerable population? Because these are groups that have not been together for several months now.
Right, that's a very important question. And what we're seeing is that coronavirus cases are really declining across all of the age groups, except for the 10 to 30-year-old age group. And so that's going to be really seen now as kids and teenage young adults are re-entering school, whether it's university or elementary, middle school, high school. We're going to start seeing those cases increase. Part of this comes from sort of the misconception that this age group is at lower risk. And while they are at lower risk for severe disease, they are just as susceptible to infection.
The number of confirmed cases is slowly dwindling, as are deaths. Many people are anxious and ready to go about their day to day, but it certainly doesn't mean that we're out of the woods yet, does it?
No, we are not out of the woods. The numbers are looking fantastic. And so, for example, in Arizona, we went from a horrible surge in July to really impressive declines in case numbers. But we're not out of the woods. And with universities opening and businesses reopening, we are in a really precarious place right now to start seeing numbers climb again. What we've seen in the country is that rates of transmission have really dropped but then surged back up, and they're going up and down. We need to really be able to maintain rates of transmission at 1 or below. And so that's where Arizona is right now. And so we have a good chance now to keep this under control, but we have to continue that. And so important to that is that we maintain distancing, we maintain wearing masks and the hand washing.
Why do you suppose we weren't encouraged to wear masks way back in January, for example, when you and I were first talking about this virus
That's
beginning to
right.
spread?
And that's because we really thought the distancing would be enough. But we now know the virus can be shed just with a simple exhale. And we know that people who are not infected are actually able to, or I'm sorry, for people who are not symptomatic are actually able to shed virus. And we really didn't understand that in January. I think people always think scientists are changing their minds, but it's really, we're just learning. And this is actually part of the process.
Okay, Dr. Goodrum, thank you.
Thank you. It was great to be here.